Hi, this is Tony Welch, Vice President of Human Resources for the Medical Center. Welcome to 60 Minutes, a Review. Let's talk about benefits. Last fall, during 60 Minutes, we announced we would be moving to a consumer-driven health plan starting in January of 2016. The plan we reviewed with you at that time was a health savings account plan, and that plan had high deductibles and very limited benefits until you maxed out your deductibles. Since then, we've spent a great deal of time researching and analyzing other plan options to find something that is a better fit for our employees and for the medical center in general. Fortunately, the plan we're rolling out today is vastly different from what you saw in 2014, and we think you're going to be pleased with the results. If you attended 60 Minutes last year, you may remember seeing this slide. This slide shows that our plan design efforts are focused in four primary objectives. Number one is designing plan features focused on fairness to employees. And fairness means that if you use more, you pay a little more. Improving plan design efficiencies. We want to make sure that you get the most value for the dollars you are spending on health care. And we also want to make sure that the medical center gets the most value for the dollars we spend on health care. Maintaining a strong emphasis on wellness. This is very important to us because we have a very well-developed wellness program here, and we're already starting to see some positive results on the health of our employees. And last and most confounding to us is complying with all the plan regulations, including health care reform. And this has kind of been the fly in the ointment as we've gone forward with our plan design efforts. The Affordable Care Act is the law of the land. Unfortunately, the interpretive guidelines that tell us how we're supposed to meet the laws have not been developed. And quite honestly, it seems that some of the regulations are contradictory to other regulations within the healthcare law. So as those are developed, things may have to change, not just here, but for all companies that provide health insurance to their employees. And lastly, this approach guides each benefit decision we make so we can continue to offer plans that are fair, smart, and competitive. So where do we go from here? Right now we have a traditional PPO plan. Unfortunately, that plan is not sustainable into the future. As a matter of fact, our actuaries tell us that if we continue with our current plan, in 2016, we'll spend an extra $2.1 million over what we spent in 2015, and that's simply not something that we can afford to do. The healthcare exchange is another option, and this is the cornerstone of Obamacare. And what this has done is it's provided health insurance to citizens who have previously not been able to get health insurance through their employers. And approximately 21 million people now have access to health care who did not have health care in the past. Some employers are actually getting out of providing health care insurance. They're providing employees with a stipend or an amount of money and telling them to go on the exchange and purchase whatever plan they choose. Most of those plans have very high deductibles, and you really have to spend a lot of your own money before you get any benefit. And as we are healthcare, the healthcare exchange is not an option for us. The health savings account is a plan we talked about at the end of 2014 as our primary option for 2016. And the health savings account is considered a consumer-driven health plan. It's also considered a qualified health plan. So think of a health savings account plan the same way you would your 401A or 457 plan. There are a lot of regulations that govern those plans, and our ability to customize those plan options are extremely limited. And because of that, the health savings account is not a viable option for us. So that leaves us with the health reimbursement account. The health reimbursement account has a lot of the same features and benefits of a health savings account, but it's much more customizable for the population we serve. So the benefit changes for 2016 look like this. We're moving to a consumer-driven health plan with a health reimbursement account option. A health reimbursement account is basically an amount of money that's placed into an account on your behalf. That money is contributed by the medical center, and it can be used to offset some of your deductible expenses. And this is how it works. The deductibles for 2016 will be $1,000 for single coverage and $2,000 for family coverage. The HRA funds will be applied once the first $500 of the single deductible or $1,000 of the family deductible is met. In other words, if you have single coverage and you spend $1,000 next year, the first $500 of that is your responsibility. So you will pay the first $500. If you have another $500 of expenses, then the HRA will automatically kick in and pay the remainder of your deductible. After that is paid, any additional expenses will be paid on a co-insurance basis, and we'll talk a little bit more about that shortly. There's no change to the out-of-pocket maximums, and copays still apply to office visits and pharmacy benefits, but you will not have to meet your deductible first. This is one of the main reasons we decided against the health savings account option, because under the health savings account, you have to meet the entire deductible before you get any benefit. Under the HRA, we have the option to continue with the copays. Premiums will not increase this year for any category. Last year we were able to reduce premiums a little bit, and we're able to maintain that for the coming year. Savings from the plan design changes are given back to employees in the HRA contributions. This new plan is going to save the medical center money. What we're doing is we're investing those savings into these HRA contributions on behalf of employees. Why would we do that? Well, very simply, over time, the medical center will realize savings as a result of the design changes. SAMC will contribute to your health reimbursement account if you participate in the wellness work screening. And if you are single, you get $500 towards your HRA. For family, you get $1,000 towards your HRA. Unused HRA funds will roll over for next year, and this is an effective deductible change of $100 from the current plan. Right now you have a $400 single deductible, and under the new plan, although the deductible will be $1,000 for single coverage, you will pay the first $500 and your HRA funds will kick in and pay the remainder. Health reimbursement accounts. Let's talk about them for a minute. The contributions are made by the medical center. They're used to offset your deductible expenses. They're available for use by any covered member on your medical plan after the thresholds are met. And again, the thresholds are $500 for single coverage and $1,000 for family coverage. If you have family coverage and you individually hit your $500 limit, the next $500 will be paid by your health reimbursement account, even though you have family coverage. The rest of the family would have to meet the remaining $500 before the additional $500 in your HRA would kick in. The funds are automatically used once you meet $500 of the $1,000 deductible or $1,000 of the $2,000 family deductible. So Blue Cross Blue Shield will adjudicate this for you. You don't have to pay and get reimbursed or anything like that. Now, the HRA funds are only available for services performed at the medical center and at in-network physician offices. What is an in-network physician office? An in-network physician office is any physician office who accepts Blue Cross Blue Shield, and that's pretty much everyone. We do ask that whenever possible you have services performed at the medical center. We need to support the physicians who are supporting our patients and our jobs here at the medical center. Unused funds will roll over to the next year. So let's say you have single coverage and you get sick a couple of times during the year. You go to the doctor, you pay your copay, you get a prescription, you pay a copay for that, and you've not even touched that HRA contribution of $500. So that $500 rolls over to 2017, and any additional HRA contributions that the medical center makes in 2017 will add to that. Those funds never expire. They're always available for use, and over time those funds will build up and will be available if you have a major health plan expense. The other thing is you can continue to contribute to your flexible spending account as in years past. So if you put money aside in a flexible spending account to offset your deductible or co-insurance expenses, you can continue to do so. So the plan highlights for 2016. Across the top you see SAMC, other PPO, and non-PPO. So SAMC is any services performed at the medical center, and those services performed by in-network physicians. And again, in-network physicians are those physicians who accept Blue Cross Blue Shield. Other PPO are basically facilities who are not affiliated with the medical center. Other hospitals, surgical centers, imaging centers, things like that. So if you tend to go to those places, you're going to have a higher out-of-pocket payment for that. And non-PPO would be service providers who do not participate with Blue Cross in any way. So the calendar year deductible, again, $1,000, $2,000 at the medical center. If you go to Flowers or an unaffiliated surgical center, you're looking at a $2,000 or $4,000 deductible, etc. The annual out-of-pocket max is $4,000 for single, $8,000 for family. And this is one of the few healthcare insurance benefit terms that actually means what it says. So if your out-of-pocket max is $4,000, that means no matter how much money you spend in healthcare over the course of the year, the maximum you will pay, and co-pays, deductibles, co-insurance, the max you will pay, regardless of charges, is $4,000 for single or $8,000 for family. For inpatient hospital, outpatient surgery, emergency room visits, lab pathology, diagnostic x-ray, chemotherapy, radiation therapy, IV therapy, hemodialysis, advanced imaging procedures, durable medical equipment, all of those will be covered at 90% after deductible. So once you meet your deductible, you pay 10% and the medical center will pay 90% of the allowable charges. That's not what's billed, that's what is allowed. On average, the medical center collects about 20 cents on the dollar. So if you have a $100,000 charge, the medical center allowable charge would be about $20,000. Now that's an extreme example, but it's an example that I think everyone can relate to. We're able to keep the prescription drugs at the same copays as we had last year. Again, we dropped the copays a little bit last year, and we're very pleased that we're able to continue that for 2006. So what are the reasons for selecting the HRA versus the HSA plan? The HRA provides covered members with lower cost access to primary care visits and prescriptions through copays. If you remember the health savings account plan, you have to pay first dollar up to those higher deductibles before you get any benefit from the plan. So it's overall less expensive for employees than the health savings account. The deductibles are lower. It allows the wellness initiatives to continue unchanged. Under the health savings account option, we would actually have to charge you for the Wellness Works physicals. And the Wellness Works program is something we're very proud of. It's actually showing some positive results for our employees, and it's something that we are committed to keeping. It allows for more flexibility in providing lower costs to employees when services are provided at the medical center, and employees can continue to use their flexible spending account to pay for the first half of their deductible before the HRA funds are available. So here's another slide you might have seen last year if you attended the 60 Minutes presentation, and this is kind of our motto for our wellness program. Get healthy, live longer, spend less. Here's some of the tips. Get an annual physical health screen through your insurance. Remember, your insurance plan pays for an annual physical with your primary care doctor. Take your maintenance drugs as prescribed. Make small diet changes at each meal. Get up and move. The more you move, the more calories you burn, the better you feel. Turn off your TV and cell phone at least an hour before bed. Helps your body relax, unwind, and prepare for sleep. And participate in your health. When you go to the doctor, make sure you get your questions answered. Make sure you fully disclose everything that's going on with you so the doctor can do a good job of helping you manage your health. That's it for the overview of the 2016 benefits plans. There's also an FAQ posted from the questions we received during the 60 Minutes program back in July. In addition, there will be information posted on the intranet, in the stat, and in Around the Block in 90 seconds. So there will be plenty more information available as we get closer to open enrollment. Keep in mind that this will be a full-blown open enrollment this year, so you'll need to enroll in order to participate in health. Thanks for your time, and we'll see you at open enrollment.